Hey guys, I'm Maya.
And I'm Ria.
And welcome to our new channel called
Sci Twins,
where we explain stuff about various microbiology topics, including viruses and bacteria and the diseases they cause.
For our first video, we decided to focus on COVID-19, especially because it has such a large impact on all of us right now.
COVID-19 is the name of the disease caused by SARS-CoV-2, which is the novel coronavirus.
First, we're going to start by explaining its viral structure, and then we'll go ahead and talk about the epidemiology and other more interesting details about the virus.
Here's a cartoon cross-section of what a viral particle would look like. The spike protein, or S protein, is on the outside of the virus, and it's used to attach the virus onto a cell. Here's a fun fact. Corona in Latin means crown, and the spike proteins on coronaviruses make the virus look like they have a crown, and hence the name coronavirus. Next, we have the membrane protein, which is the main determiner in the shape of the viral particle. Then, we have the envelope protein, which is involved in virus assembly and morphogenesis. And lastly, the nucleocapsid protein, which is attached to the viral genome itself.
Now we're going to go over the epidemiological aspect of the coronavirus. COVID-19 first appeared in Wuhan, China. The first reported case was on December 1st, 2019. Officials are still trying to find out the location of the origin of the virus, and they're still looking. The incubation period of the virus, so the time from exposure to onset of symptoms, is between 2 to 14 days.
Transmission of the virus is mainly through droplet transmission, like when someone sneezes on you. It is speculated that it can be spread from person to person, like if someone hugs you. The coronavirus is also suggested to be transmitted through fomites, which are contaminated, non-living objects. For example, if you have the virus but are asymptomatic, meaning that you show no symptoms, and if you sneeze on your hands and then touch your phone becomes a fomite. If you pass your phone to a friend and they put it up to their face to call someone, they can become infected by the phone. It is also speculated that fecal-oral transmission of the virus is possible. Here's an example of why social distancing is really important. You might think that you have some allergies, but you decide to go to your grandparents' house and hug your grandmother. You might not know it yet, but you have the virus and have just passed it on to her. Your grandmother is more at risk than you are because of her age and many other potential conditions which could make her immunosuppressed. This could lead to her contracting the severe form of coronavirus, which can be deadly to the older and immunosuppressed populations. This is why a simple, seemingly normal hug could lead to disastrous circumstances. And it is also why there is such a large emphasis on social distancing. Since there is a semi-long incubation period and most cases resemble a common cold, the virus can spread much faster. COVID-19 has three main forms: mild, severe, and critical. The mild form is something like a cold. It lasts about 1 to 2 weeks and affects 80% of the coronavirus patients. The severe form of the disease is present in about 15% of patients and occurs usually 5 to 7 days after symptoms arise. In this form, patients experience difficulty breathing, hypoxia, and develop pneumonia. Lastly, in this critical form of COVID-19, patients experience severe pneumonia, which leads to respiratory failure, shock, and possibly multi-organ failure. This form of the disease occurs in about 5% of patients. Development of a vaccine could take up to 12 to 18 months, and there is no official treatment for COVID-19 as of now. So washing hands, avoiding touching your face, and practicing social distancing are some of the best things that we can do to save lives.
Please remember to like and subscribe.